The cost of nutritious food and the lack of access to it are of significant concern to U.S. consumers. A new national poll conducted by Zogby Analytics on behalf of Research America and the American Heart Association reveals that nearly 7 in 10 respondents recognize healthy eating habits as crucial for a long and healthy life. Despite this recognition, more than half of the respondents believe the United States is not making enough progress in making nutritious food more accessible and affordable. The poll highlights that 94% of respondents view obesity as a serious concern, with more than 3 in 4 expressing a desire to eat healthier. However, significant barriers such as the cost of healthy food, stress eating, lack of preparation time, and insufficient knowledge about healthy foods hinder their efforts. The expert analysis released by Deloitte, the American Heart Association, and Research America outlines the urgent challenges in creating a food system that integrates nutritious food into healthcare. According to projections published in the American Heart Association's journal Circulation, by 2050, more than 6 in 10 U.S. adults are expected to have some form of cardiovascular disease, driven by a sharp increase in obesity rates. Obesity rates in adults are projected to rise from 43.6% to 60.6%, and in children from 20.6% to 33%. The poll also reveals significant differences in how various demographic groups perceive barriers to healthy eating. For instance, nearly 7 in 10 Asian American and Hispanic respondents cite the cost of healthy food as their biggest barrier. Black respondents are more likely to point to gaps in knowledge about healthy food and difficulty accessing stores that carry nutrient-dense foods. These barriers highlight the systemic factors that make it difficult for people to access healthy food. The U.S. Health and the Future of Food report implicates food and nutrition insecurity, ultra-processed foods, and the lack of resilient food systems as major contributors to poor diets. Approximately 1 in 7 people in the U.S. faced food insecurity in 2022, including 13 million children. The impact of food insecurity is felt disproportionately in rural and southern U.S. counties. Factors such as consumer preferences, cultural norms, unhealthy food marketing, and social inequities further impede access to healthy foods, significantly raising the risk of chronic conditions like cardiovascular disease. The report calls for stakeholders, including healthcare professionals, food industries, and policymakers, to drive innovations that enable food systems to bolster health outcomes. Kevin Volpe, Maryland, PhD, emphasizes the need for cross-sector collaboration and research-backed innovation to stem the combined tidal wave of obesity and nutrition insecurity. The American Heart Association's Healthcare by Food initiative is investing in research, advocacy, and education to integrate cost-effective food as medicine approaches into the healthcare system. Initial pilot studies are underway to demonstrate the effectiveness of healthy food interventions. Additionally, the association is collaborating with the Periodic Table of Food initiative to better understand food biodiversity and inform dietary recommendations. Nancy Brown, CEO of the American Heart Association, stresses the need for bold moves to change the troubling trajectory of cardiovascular disease. The association plans to launch a novel, longitudinal direct-to-patient registry to improve understanding of obesity and its management. Brown calls on public and private entities to embrace innovative and comprehensive approaches to improve the nation's health. Collaborative efforts are imperative to ensure that every person has access to nutritious food that leads to better health. Join us in this fight to shape the course of public health in the next century.